Okay. Thank you, Anya. Thank you, Yair, for the introductions and stressing the point of research as serving a foundation for medical progress, any progress, human progress, but medical in general. So what I'd like to do, with your permission, is to set the stage for what is to come in the next hour. I'd like to introduce you to the concept of case reports, specifically case reports, why, how, who, when, and what are the beneficiaries, etc. So get some ground rules. Introduce you to some already made tools that the Research Task Force has made available for you, and programs that will be coming out as well, and then allow my colleagues to then dive deeper into these particular cases or particular tools that we've created. The key component of case reports, as Dr. Yair indicated earlier, is the pyramid, right? And interestingly enough, classically, historically, every one of us in this field have studied medicine, studied wisdom of epochs, of thousands of years old information that disseminates, that reaches us. Well, the classic way of getting that information to us has been through case reports. All of the classics contain many, many personal case reports from physicians, from various experts, even from the Yellow Emperor down to the most recent TCM practitioners who are contributing through case reports. But even beyond that, I think even from the development of allopathic conservative medicine, the initial contribution to medical innovation was case reporting. As Vanderbroek in 2001 research stated, it has served to be the cornerstone for all medical progress. And it's important to stress that, because I think what case reporting is and what it offers is why it is so essential in building this pyramid. If you look at the pyramid structure, most focus right now is on meta-analysis, RCTs or non-random control trials, etc. But at the base of that, the foundational base, building blocks, are expert opinions, the anecdotal data, and or the case reports, the series of case reports, observational studies. These are what create the hypotheses. They create the driving force for then building these more advanced research programs. So what does a case report offer? Well, it is a novel, unique observation into something specific, a condition that's specific, a treatment that's specific, an approach that's specific, and it serves as the seed for hypothesis formation. It is flexible, therefore it allows for faster formation and dissemination, and assesses the effects and the cost intervention, the cost of the interventions, etc. And it offers opportunities for clinical changes, adaptation of clinical practice. Something new has come up, a novel way to treat something has come up, and that changes or adapts the clinical practice in general to the case or the condition that we're treating. And it serves as an essential information tool for educational purposes. This is why when you look at all the major journals, medical journals out there, they are beginning to embrace and expand their coverage of case reports, because it has a direct impact on their impact factor. And all of these major, specifically alternative medicine journals, have basically seen an increase in their impact factor because of that fact that they're including more case reports and more case relevant data as content in their medical journals. So the whys, the hows, the whats, well, why do we write case reports? Why does anybody write case reports? First and foremost, it contributes to the knowledge. It helps build the knowledge base, whether it's about our medicine, whether it's about allopathic medicine. Case reports allow us to build content, build knowledge. It builds representation. For us, specifically in the TCM field, it will help us improve our representation. It offers talking points, create unique ideas for hypothesis formation, to expand research opportunities, to create new research potential, if you will. And as I said, it's an educational tool, not just for us and for our profession, but for the layman, for someone who's not familiar with our medicine and its abilities, for the lobbying tool set, for the lawmakers, for our colleagues, for our patients, etc. How does it benefit you as a clinician, as a practitioner? Well, first and foremost, it increases your visibility. It builds credibility. It establishes esteem with other colleagues, with other professionals that are in the field that you're going to be collaborating with. If we as a profession want to be part of the mainstream medical disciplines out there, mainstream healthcare landscape, we must learn and we must contribute and we must participate in an establishment in a collaborative way. And these case reports can help build that esteem, build that credibility, and ultimately serves as a platform for sharing that knowledge. Remember, unified, we're stronger. Individually, we're weak. And so the more unified we are in our knowledge sharing, in our successes, the stronger we as individuals and as practitioners can become as a profession. What are the key factors that contribute to a successful case report? You'll learn much greater detail in a coming session, but must be a novel or a unique approach. It could be something, a new way of looking at a condition that's been treated, or your personalized touch to how you fixed a certain pathology or how you addressed a certain treatment modality. It must offer new ideas for hypothesis formation and maybe expand on creating new ways of testing that new treatment or that new approach. Must be well written and must follow some academic format that is defined by the various journals out there. And we'll talk more about that. I think my colleagues will be sharing more about those specific tools available. So who are the stakeholders? Well, first and foremost, it's your patients, right? They now have the ability to compare therapeutic options. Here's a case report on how to treat my headache. Here's another case report that another way of treating that headache. So they have now an educated means of addressing therapeutic options available for them. Clinicians, other colleagues, people who are in the field, they can engage in peer-to-peer communication, enhance their practice, adapt to changing environments, integrate new modalities or new techniques in their practice that will ultimately improve their patient outcomes. Researchers, this gives the research community grand ideas to expand on, to create new hypotheses, new research models, or maybe even create a multidisciplinary, a large-scale RCT or a meta-analysis based on various hundreds and thousands of case reports, etc. Educators, it's one of the best tools for our educators. If you're teaching in a college, if you're teaching in a medical university, case reports are one of the best ways to disseminate knowledge of the medicine through identifying it in real-world applications. Authors, people who have generated these case reports, again, as I said earlier, garner representation, create visibility, credibility, and ultimately the medical journals benefit from that because it creates content, improves their knowledge repository, and increases their impact factor. So what is a case report in a very brief overview? The concept is basically independent paragraphs that are linked together that describe a very specific, unique case. First and foremost, this is just a summary of a toolkit, which we have already provided for you. It is an infographic that can be found in the directory from the Research Task Force, and it breaks down the steps and the components of a case report in a general term. Now, you can adapt that to whatever format you're following. If you're doing CARE format, or if you're doing some additional types of case reporting tools or standards, you can adapt the tools. But the idea is basically to identify the unique case, to examine that case, collect all the relevant data from that case, do some research, understand what else is being done out there, who else has published related materials or related therapeutic modalities for that type of condition or that type of patient. Collect all that information, analyze it if you need to do statistical analysis or if you're doing any massaging of that data. Once you're done analyzing it, you compile it, and then you submit it for publication. You definitely send it to RTF. We should be the first person to get copies of your potential research notes or your case reports. We can review them, add it to our collective knowledge base, and then assist you to expand it further in terms of publications. So again, the steps, I'm not going to go through in greater detail, but the tool and the infographic will clearly outline these, the specific things. Two key things I want to stress about this. Case reports must be unanimous. They must be de-identified in order to make sure that patient privacy and patient confidentiality is mentioned. And if you are doing literature reviews, make sure that you follow the appropriate AMA or APA citation formats so that you don't have problems later on in terms of submitting it to various organizations. Tools available, you're going to learn a lot more about it. One of the things that I want to stress about is the MyMop. This is a toolkit that allows you to assess patient self-measurement for outcomes. Anytime you're doing any objective analysis of therapeutic intervention, the key component is to stay objective. You know, you as a physician saying, well, I gave him this treatment and he feels 100% better is insignificant. It's non-relevant. What is important is with a patient reporting improvement at the very least. You know, in scientific modes, there are other measurement tools. You could do blood tests, you could do MRIs, fMRIs, etc., which are much more scientific or rigorous. However, in case reports, at the very least, you want the patient's input. You want the patient's self-outcomes, self-reported outcomes. And so we've created, following the Meaningful Measures MyMopD format, we've created a form, a Google form that you can use, customize, tweak, send it to your patients if you're going to use them in case reporting. And they will be able to report on a scale of Likert scale basis their success and their response to your patient, to your treatments. And therefore, you can start measuring patient outcomes more relevantly. And then other tools, which my colleagues will be discussing with you later on. So in summary, how do you do case reporting? Well, in the coming months, the RTF will be putting out more tools, more relevant information. You may have already seen Meet the Expert interview series on our YouTube channel where we interview various experts in various fields and how they conduct research, etc. We'll be putting out more tools, more specific TCM-related case reporting tools or standards, instructional videos, and we're in discussions to offer master classes for you, for those of you who are really interested in moving forward in research materials. The who and the what we've already discussed. You know, who's going to benefit: the patient, the clinicians, the researchers, the educators, you yourself as an author. The what, you know, help build the repository, improve the knowledge, share novelty cases, and create a movement to expand and improve research, clinical research in TCM. And then why, ultimately, it just improves our visibility and our task as a profession in mainstreaming TCM in the medical landscape of Europe and the world itself. So thank you very much. And I'm going to turn my session over to who's following after me, Anya?
It's Mark.
Excellent. Well, my colleague Mark will then take over from this point.